Hi, welcome to another episode of Talking with Docs. I am Dr. Paul Zalzal.
And I'm Dr. Brad Wiening.
Okay, Brad, today's topic is timely, and hopefully people will need to watch this video in a few months and it'll be old news. But for now, we're going to talk about, is it safe to go, or should I go to the hospital or the emergency room or see my doctor in the middle of this pandemic?
Okay, really important topic. There's been a lot of chatter about it, and a lot of people have a lot of views and not necessarily based on facts about being worried about going. So we need to kind of debunk some of the myths and let people know maybe what the best approach is if you're sick.
Yeah, so here's the scenario. You think something's wrong, you think you're not well, but you're like, I don't want to go see my doctor, I don't want to go to the emergency room, I don't want to go to the walk-in clinic, I don't want to go to the hospital because I'm worried about catching COVID if I go to one of those places.
And certainly people are very afraid, obviously, of COVID. A lot of people have gotten sick and a lot of people have died, so that's not surprising. However,
the only thing to fear
is fear itself. I think, and COVID-19. I think now there's two things on that list: fear and COVID-19. So what's the short answer? Should you go?
Go.
Obviously.
I mean, it seems obvious, right?
You gotta go.
Yeah. Well, I mean, it's a balance of risks, right? Sure, when you step out of your house, there's a risk of getting COVID-19. But no matter what country puts in a lockdown or any province or jurisdiction that locks down, they always say you're allowed to leave your house for medical issues. Okay?
That's the first reason, so it's not illegal.
No.
Yes, good point.
It's not. And so if you balance your risk of catching COVID is there, but your risk of something bad happening if you're not well and you don't go get medical help is higher. Way higher.
Totally agree. And I think the other thing to recognize, it's not like, I hate to use this as an example, like in the movie Contagion. You know, like when you go to the hospital, people have PPE, they have specific procedures in place, they have screening checks for visitors and the patients themselves. So they're prepared to deal with this in a way that's going to drastically reduce the spread. So the odds of you getting it at the hospital are actually very, very low.
Yeah, very low. And the reason we're making this video is because we've all either had patients or heard stories where people are delaying their medical treatment for fear of contracting the COVID-19 virus.
We've even had comments on our YouTube channel saying, hey, should I go to the doctor? You know, I fell and my ankle's swollen and I can't put any weight on it. And I mean, obviously the answer is you have to do something. You can't just ignore it because of fear.
Yeah. And I mean, our videos are helpful. We've heard, thank God for people who are worried about going, but certainly go. So what are your options? You can either, go in person to the emergency room, walk-in clinic, your family doctor. However, if you are really paralyzed with fear and you don't want to go do that, you do have other options to get medical advice.
Or even if you have other access issues, you don't have a car, or you don't have someone that can drive you or whatever, I would say, I think you're referring to virtual or telemedicine has really exploded in the last 10 months.
So there's a lot of virtual clinics online. You can at least start your medical investigation and treatment process online with a physician. If you just look for it online, there are a lot of options available for virtual healthcare too.
And then someone can go through your signs and your symptoms as well as your potential options. You can explain the severity, and then together you can come with a safer, more formalized treatment plan.
So don't sit there at home and suffer or worry or possibly miss something. Get medical help if you need it.
And I think this would also apply not just to emergency kind of stuff, but I think your general health. So if you have high blood pressure, if you have diabetes, if you have risk of colon cancer or whatever, I still think we need to follow the regular treatment and screening protocols, because unfortunately one of the hard to measure effects of the pandemic are going to be those subtle diseases that maybe get a little bit worse or are poorly managed because of fear or because of access or for a host of reasons. So you really need to advocate a little bit for your own health, because who knows, your family doctor's office might be closed or they're doing telemedicine or whatever. You need to sometimes bark a little bit so that people hear you and know that you do have some stuff going on that needs to be, particularly mental health, even more than ever, right?
Oh boy, So that's two good points there. One, chronic illness. If you have chronic illness, now's not the time to let it go by the wayside because you're afraid of getting sick by leaving the house. So your chronic, not only your emergencies or new medical issues, but your chronic illnesses too. You got to get those taken care of. and mental health. Yeah, if you're feeling like something's wrong, you're not alone. But if it's becoming overwhelming for you or you're concerned, get the medical health help that you need.
And especially with telemedicine, even just having someone to talk to about what you're feeling or what you're going through, they can give you some suggestions on ways to help cope, whether that's through therapy or medication or connecting with someone, whatever. Anxiety and depression is very common in our society, and it's definitely been amplified by the pandemic. So please reach out to someone to get some help.
Okay, so bottom line, your health still goes on, right? So you still have to take care of yourself. COVID-19 is not the only medical issue right now that people can get. There are still all your chronic illnesses, other emergencies, mental health issues, so you can't ignore those.
So if you like this video, please like it, subscribe to our channel.
And now more than ever, remember, you are in charge of your own health.
We'll see you next time. Stay safe.